Ladies and gentlemen, do you remember how you got to your seat? You walked up a tiered corridor, down railless stairs, and manoeuvred yourself into your low-set chair. Now imagine doing so with only one leg. Daily obstacles, such as railless stairs, are a reality for over 20,000 Australian amputees. However, as Australians, they receive the highest quality of care and state-of-the-art prosthetics. They can live a relatively normal life. This is not the situation for the 500,000 amputees living in Southeast Asia. Below-knee prosthetics are made up of three components: the socket, the shank, and the foot. The socket is the most important of the components, determining the comfort and the fit for the amputee. However, given the uniqueness of each amputee's stump, it is also the most difficult to manufacture. Traditional manufacture techniques rely not on the use of high-tech machines, but on the hands of the prosthetist. They apply knowledge and skills learned over a 5-year university degree to mould each socket to each amputee's stump. The technique is hugely successful. However, it's also highly reliant on the skill and experience of the prosthetist. My research revolves around a novel technique to mould sockets called pressure casting, or P-cast. The aim of the P-cast technique is to minimise this reliance on the prosthetist, making it ideal for developing countries like Cambodia and Vietnam, where there's a shortage of skilled and qualified prosthetists, and yet an abnormally high number of amputees due to war, landmine and traffic accidents. During the P-cast technique, the patient places their stump, wrapped in plaster, into the P-cast tank. At the turn of a tap, water enters the tank until the pressure is sufficient to support half of their weight. At this point, the water pressure then works to uniformly push and mould the plaster till it's the exact shape of the amputee's stump. After 2 or 3 minutes, or less time than it takes me to finish this speech, it's done. Essentially, if you can turn a tap, you can mould a socket. The P-cast tank is completely portable. It's inexpensive to manufacture and it requires only running water to operate. To date, we've cast 50 Vietnamese amputees with P-cast sockets. Testing has shown that they have levels of functionality and satisfaction equal to that of amputees in Australia. Now, there's not too much that I can do about the landmines, the war, the traffic accidents and the birth defects that are causing these amputations. But what we can work towards is providing comfortable and well-designed prosthetics so that amputees in developing nations, just like those in Australia, can live with restored functionality, increased employment opportunities and improved self-worth, and that they too can navigate everyday obstacles such as a tiered corridor, a railless staircase or a low-set chair. Thank you.